Welcome. My name is Steve Spurlock, and it is a pleasure to have you all here with me today. I want to go over a few things that will help you as instructors get the most out of your students and the most out of yourselves. Motivated instructors equal motivated students. This is a continuous cycle. Give your best effort, and you will see a better effort from your students. First, let's discuss instructional goals versus learning outcomes. These should be included in and begin your lesson plan. Instructional goals simply explain what is about to be taught. They describe an activity, when it will be used, and what context it should occur. Here's an example. After completion of this lesson, the student will understand the need for interpersonal communication, the purpose and role of emergency medical dispatchers, and understand the use of radios for communications. With this, we lay out what is going to happen, what the students should know, and what context they will be using that. Learning outcomes are just as equally important. Learning outcomes are essentially objectives. They describe what the student will have learned and what skills and actions they will be able to perform after the lesson. An example of that would be, let's say, for the communications. Describe how stress, emotions, and general demeanor affect communications. Identify the different forms of communication, challenges with communications, and technology commonly associated with emergency services communication. Demonstrate skills necessary to effectively communicate with dispatchers, patients, and other medical professionals. These are examples of learning outcomes, what you expect the student to know after the lesson is over. Goals and outcomes help keep students on track and help with critical thinking and applying their knowledge in an emergency setting. Knowing the goals and expected outcomes at the beginning of class allows the student to visualize real-life applications as they are learning. Teacher-centered learning is the age-old practice of lecturing. The teacher lectures and the student listens and takes notes. During this time, a student that knows the instructional goals will be able to visualize themselves in a situation to use that knowledge. Student-centered learning, or flipping the classroom, engages the student, places them in hands-on role-playing situations, thus promoting their ability to think on their feet. This introduction to critical thinking while in the classroom will foster their ability to think critically in the field. Lastly, let's talk about putting it all together to incorporate different forms of teaching, and let's discuss activities to meet your instructional goals and expected learning outcomes. Independent learning taps the cognitive domain. Reading the lesson chapters prior to class allows the student to get an idea of the material at their own pace and prepares them to understand better as class begins. Certain subjects lend themselves to this type of learning. EKGs and pharmacology come to mind. We're making flashcards and just reading the material and looking to memorize some of it would be effective. Small groups encourage collaboration and discussion. These are a lot more fun. This is what students nowadays are craving. All right, so some small group activities can include case studies or skill labs, and my personal favorite, role playing. They all have their place depending on the subject matter. Role play works great for communications and patient assessment, and it teaches across all domains. Beyond that, it can be quite humorous and a great deal of fun. Another tool that I found useful is allowing the students to teach a lesson. This gives them an understanding of the effort required to prepare a class and the challenges of public speaking and class disruption. This requires them to research and present the material to the rest of the class and experience and appreciate what you as an instructor have to do each and every lesson. In closing, there are many ways to teach, and there are more ways to learn. No one way is perfect, but they all have their place. Keep it fun, be creative, and inspire your students. Have a good day.